Good morning, everybody. Welcome to our COVID-19 vaccination webinar. This morning, we're going to be talking about tips and ideas for engaging with 5 to 11-year-olds and their parents. As you know, we are waiting for Cabinet approval for the rollout of the COVID-19 Vaccination Programme for 5 to 11-year-olds using the child version of the Pfizer vaccine. And we're expecting that we'll be starting sometime from mid-January and using our existing vaccination delivery methods, for example, primary care, vaccination centres, pop-up events, outreach activities and pharmacies. So this morning, I would like to introduce you to our speakers. We have Alex Long and Fiona Murray. Alex Long is a nurse educator at the NRHCC, which is the Northern Region Health Coordinating Centre. Alex has trained over 100 COVID-19 vaccinators since April 2021. She also coordinates the Registered Nurse Prescribing and Community Health Programme in Metro Auckland 2 days a week. Alex has a background in public health and is an authorised vaccinator and a clinical assessor. And Fiona Murray is a nurse educator with the Waitemata DHB Primary Healthcare Nursing Development Team, and she also works at the NRHCC for the COVID-19 Vaccination Programme since April this year. Fiona has a background in practice nursing and in paediatrics. And with me also, I will have, for questions, Dr. Anthony Jordan, who is our clinical director at the NRHCC, and he is from the Department of General Medicine and Clinical Immunology and Allergy at Auckland District Health Board. And I have Angela Lambie, who is has a background as a pharmacist. Here she is, just popping into the screen. And she is our operations lead for vaccination sites at the NRHCC. And I totally forgot to introduce myself. I'm Jean McQueen. In my normal life, I'm the primary healthcare nurse director for Auckland and Waitemata DHBs. In this last year, I've been the nursing director at the NRHCC for the vaccine rollout program. So just a few little bits of housekeeping. You're welcome to use the question and answer function to ask questions. It'd be really good if you could keep these brief and check to see if someone else has already asked the question, so it makes it easier for us to manage those questions. The session is being recorded and it will be sent out afterwards. And we'd love your feedback on the webinar, so we'll have a short poll at the end when you click off. So now let's get started and I'll hand over to Alex Long and Fiona Murray.
Thank you, Jean. Kia ora, I'm Fiona Murray, nurse educator primary healthcare. I'll be sharing the presentation this morning with my colleague Alex Long.
Morena, kia ora everybody, welcome and thank you for joining us for our webinar this morning as we look ahead to the rollout of the COVID immunisation for our 5 to 11-year-old population. The presentation this morning has a focus on how to connect with this age group and the parents and whānau during the immunisation process. So we aim to cover a bit about how this age group are different, some tips and tools for engagement, and some considerations around the consent process. So working with this age group, we may encounter different variables, and it's not just the child as the patient, but the parents, whānau and guardians that will be involved in the process. So give consideration to the possibility that the decision makers may be young parents themselves, or for some maybe grandparents or legal guardians. They may be influenced by other family members who have had the vaccine, or they may have received misinformation from social media. We want them to feel that the messages that they receive can be trusted, with these voices coming from health professionals or community leaders. The aim is for a whānau-centred approach, empowering parents, grandparents and the tamariki. We're going to work along with these core principles that underpin the immunisation of the 5 to 11-year-olds. Aroha, love for the tamariki and their well-being, protecting them for the future. Pono, being honest, open and communicating with integrity, and provide information to enable an informed decision. And tika, the right way, in the right order, at the right time, for the right reason. So don't expect all 5 to 10-year-olds to have the same cognitive level of understanding. They're not all made the same. The physical build is different and it's not a one-size-fits-all approach. So it's really important that you take time to gauge and judge where the child in front of you is up to. Children who are tall or large for their age are often addressed as an older child because of their appearance, and some older children are small and people may speak to them as a younger child. So pitch your tone and your conversation at the level that they're at. Younger children love to show you their talents, such as singing or being brave. 5 to 8-year-olds can count backwards from 10, and they often mimic adult behaviours such as a parent or a teacher. And they can follow instructions with 3 or more steps. So, for example, take the lunchbox out of your school bag, rinse it under the tap and put it in the dishwasher. So keep what you're saying to them simple and specific so that they can understand and follow. Play is really important to them, so keep play a very playful focus. 9 to 11-year-olds will listen for specific reasons, such as a reward, pleasure or learning, and they might want to know that the immunisation is to protect them and their friends or their family and whānau. Allow them to go back to activities such as kapa haka, dance class or rugby practice. And friendship is really important to them at this age group. So ask them about their friends. Have they had their immunisation? Are you going to go and tell them about it? And you can offer whatever resources that you have on site as a reward. So it may be that after the immunisation, they get to play with the toys for 15 minutes in the observation area. Or if you've got stickers or certificates, that's great too. But don't promise rewards unless you've explicitly discussed it with a parent or caregiver. So don't offer things like lollipops if they're not allowed to have them. Check first with the parent. Rewards can work well, but can be challenging if there's a financial cost. So just be mindful of this. A parent might be better stipulating what their reward is, so the child could get to choose what movie they watch when they go home or what the family dinner is going to be for that evening. We can't imply that they can be taken to McDonald's as a reward after the immunisation, because this might not be feasible for the parent or the rest of the whānau. And the reward can be just as simple as going to the favourite park or going out to play on the scooter for a bit. So tips and tools for our 5 to 11-year-olds. The first moments that the child enters your area is going to impact the outcome of the appointment. So taking time to prepare anyone who comes into contact with them, such as the screeners or admin people. We want them to be able to channel their inner child and connect with our young consumers. So thinking about things like the Minions or Wiggles or Star Wars or Lego themes, whatever's out there at the moment. So make it a child-friendly area. Do you have specific staff who are more experienced with working with children? Nominate someone to be the children's champion. Children can smell fear, so build trust and don't rush them. Ask what's the favourite toy, what's the favourite TV show, what's the favourite food. Connect and comment on something cool about the child. Oh, I love your sneakers, I love your hair tie, I love your t-shirt, tell me about that. Don't underestimate the importance of connection at this time. Invest into the child and parent, building this trusting relationship, and think about how this might impact on things such as your booking schedule for our younger consumers. You might need to allow longer. Look at the flow and the position of the area that you're going to use. So if a child is upset, they're not going past other children who are waiting to come in and unsettle everybody. So the logistics of this is still being worked through, but just start to think about how you might prepare, store and deliver the paediatric dose in your area. So again, back to that connection, encouraging the comfort cares. They can bring their teddy, favourite toy, use of a screen, especially with the older children. Screens are an amazing distraction. Act it out if necessary. Ask, can you demonstrate on teddy or a toy? Can I show you what we're going to do, how quick it's going to be? And then give teddy a band-aid or a sticker for being good afterwards. Get down to their eye level, like it shows on the photo here. Don't tower over them. Children will find this intimidating and be more afraid. And don't restrain, but may encourage a cuddle depending on the age or the stage of the child. And we're going to go into a little bit more depth with this in a second. And acknowledge the parents' fears and reassure. You quite possibly have two patients in front of you, and don't underestimate the power of reassurance. I know when my children were younger and there was a whole MMR misinformation out there, as a mum and as a parent, as a nurse, I was, needed reassurance, and really remember the nurse at the time saying, of course, it's the best thing to do for your child, and taking that with me. So back to the cuddle hold. They are more appropriate for younger children, but don't rule it out. The power of comfort from the caregiver is major in this situation. So even the handhold or words of support gives feelings of security, which is going to be really important moving forward. So the photos here are suggestions, they're not guidelines. Left is from IMAC and the older child is CDC. And it talks about embracing the child and anchoring the child's legs between yours. And so this is also going to make them feel secure, but minimize movement, which can be problematic if you go to administer the immunization and you've got a child who's moving away from you. Saying that, we never restrain a child for a procedure such as immunization, because this is going to lead to long-term damage and resistance to engage in the future with healthcare. We have a couple more tips. Think about what you say and how you say it. So don't just talk to the parent or the adult, you talk to the child and use the name to make that connection. Avoid clinical terminology. So instead of things like injection, use immunization or medicine, and use child-friendly language, but be open and honest. So don't say it's not going to hurt, because if it does, they're going to let you know about it. Say that it's going to feel more like a scratch or a pinch. For an anxious child, you can acknowledge the fear and say, I know that, you're being really brave here. It's not going to be as bad as you think it's going to be. And point out anybody else that's around who may have had their immunization. Look, your brother's absolutely fine. He's smiling now after it. And the children in the play area, they're all okay. They've managed to get through this. Don't ask what arm that you want to give the immunization in, because the chance is they're going to say none of them. So say, shall we pop it in this arm or shall we pop it in this arm? Give them some empowerment. And don't say don't look. Instead say, you don't have to look if you don't want to. You can look away if you want to. Give them a choice. Using calm, friendly tones of voice, because loud, booming voices will be quite intimidating to children. And before the vaccination, just as adults with the 12 to 18-year-olds, provide encouragement, try and get them relaxed, make sure that they've had something to eat and drink. It's going to keep them feeling well afterwards, and make sure that they're wearing clothes that has easy access to the upper arm and you can get the correct side. And now I'm going to hand over to Fiona.
So some tools for when you're vaccinating this age group: distraction, distract. Get the children to just demonstrate their talents. They love to show you what they can do. They can count backwards. They might have a favorite song that they'd like to sing, or they might have a book that they can read to you from. So once again, as Alex said, channel your inner child, connect with that child in front of you, make it about them, what is special for them. Use of toys is encouraged, but needs to be something that can be Clinell wiped afterwards. And the glitter wands, you can usually get these from like your $2 shops for about $3.50. So they're not a huge outlay for something to have on your sites. We're not going to go too much into the giving of the vaccine itself, but just being aware that this is from IMAC, and at the moment our LDS 25 gauge by 25 millimeter needles will be appropriate for some of the older children, but we do anticipate having the 16 millimeter or the 5/8 inch shorter needle available for the smaller or younger children. Okay, so there's also the Buzzy for shots. Now, access for these would need to be discussed within your own regions. It's something that's commonly used in general practice for vaccinating childhood vaccinations. Also something that could be good for pharmacies who vaccinate moving forward for those who are needle phobic. So it's a small vibrating bee that's got blue ice pack wings on it, and he helps block the sharp pain and provides distraction when giving injections or other medical procedures. So Buzzy sits between the brain and the pain, and it confuses your body's own nerves and distracts attention away from the pain, thereby dulling or eliminating sharp injection pain. It's a bit the same as rubbing a bumped elbow helps, or cold water soothes a burn. Buzzy uses a combination of the cold and the vibration to replace pain with temperature and movement. Another tool that may be available to you, once again, this will be region by region, is the Emla Patches. Now, the Emla cream is a local anaesthetic, but once again, you would need to check for allergies or reactions to this before it's used. And some sites I do know in the Metro Auckland region do have access to these patches. They need to be applied at least 60 minutes before the procedure involving intact skin. And if you're using the cream, it also needs to be covered with an occlusive dressing. Best to be applied by the vaccinator to maintain accuracy of your site for giving your injection. And once again, guidelines around use for that would need to be region specific. The only thing though is that we only want it used if are you going to use it is for more challenging situations. We don't want it used for general use, because this is not used for childhood immunisations out in the community. So we don't want it to become an expected or routine for childhood vaccinations. So once again, a discussion within your regions as to how you're going to proceed. So consenting in this group is going to be slightly different to what you've done so far, because in this situation, you're going to be having a parent or a caregiver consenting for the child. Now this slide here, this is out of the IMAC handbook, which is a really good resource around information for consent. Consent is a fundamental concept when providing healthcare, and it involves the provision of information to enable informed choice by the consumer. So your parents, guardians, grandparents, they have the right to discuss the vaccination and make an informed decision that is right for their child. They may have seen and heard a varying degree of information, and it might not all be credible or robust. Remembering presentation for the vaccine does not imply consent. They may still have questions before they make a decision. And you need to be checking who they are. Do they have a right to give consent for that child? There may be a situation where you might need to make a phone call to a parent to get that verbal consent over the phone. So some of the things that's important to consider is connecting with the parent and guardian, making sure you've got clear and honest communication, and acknowledging any concerns they might have, and then providing full information to support any conversations around those concerns. And what you're trying to do is enable freely given competent consent. So they need to know that they do have a choice. They need to know why their tamariki is being offered the vaccine and what is involved in the vaccine they are being offered. They also need to know about the probable benefits and risks of the vaccination, including those to the child and community, and the risks and benefits of not receiving the vaccination. And there's a whole host of resources that will be coming up on the IMAC website, Ministry of Health, and just taking into consideration the Code of Rights. So communication and active listening is a very effective part of consenting. So making sure you tailor the conversation content to the needs of the person. So ensure you, as I said, respect and acknowledge any concerns. Use plain language, open-ended questions, and active listening. Avoid medical jargon, as Alex was saying. And if you do need to use medical jargon, make sure that you explain it once again in plain language. Offer resources that you have on your site, and make sure that you finish off with effective immunisation recommendations, such as, I strongly recommend you should receive these vaccines today. Doing this will help keep your child and your community safe, or this will enable you and your child to keep doing what you love most. So it's about that connection and building rapport with the people you're working alongside. And just remember, if they choose to decline, that you do advise them that they can come back at any time for any questions, or if they change their mind about vaccination, the door is always open for them to change their mind. Don't judge them on their decision. And while an adult is consenting for the child, as Alex mentioned, we can't restrain a child to forcibly administer the vaccine. Most children will follow their parents' lead. They may be nervous, but they will sit still for the vaccine if you distract them and give them that connection and encouragement. So just a reminder that under the Code of Rights, every consumer, including a child, has the right to the information they need to make an informed choice or to give informed consent. And that's right to effective communication, the right to be fully informed, and the right to make an informed choice and give informed consent. In New Zealand, there is no defined age at which a child can give consent to medical treatment. They need to be able to understand the benefits and risks involved. So here's just a slide just with some of the resources available. And we recommend that if you are quiet on your sites, that you provide an opportunity for your staff to access some of the resources, watch the videos, and even just have conversations amongst themselves about how they will approach vaccination of children. IMAC will be putting up resources, webinars, and there'll be coaching offered once their process has been signed off by the Ministry of Health. Health Navigator has some good videos and resources on vaccination for children. And there's just a couple others there. There's one by Susie Wiles also that's about connecting with children when they're having their vaccination, which is quite lighthearted. So thank you, and just wishing you all a Merry Christmas and a chance to reconnect and relax with your whānau and friends to recharge your batteries for COVID 2022. And thank you for your commitment to keeping Aotearoa safe.
So we'll go back to Jean and Angela and Anthony, and they may be looking for questions.
Thank you very much. Thank you very much, Alex and Fiona. That was very, very informative. And we will answer some questions now. We have a little bit of time. I just wanted to add, this morning I phoned Lisa Box from IMAC to get an update of where their training and their resources are, and they are now awaiting for the ministry to approve them, and then they will be able to share those. So they're hoping that it'll be later this week, and that will give you the more technical detail that we haven't covered today. Okay, we're going to answer some questions. So now I'm just going to ask Angela for the first question.
So the first question was just about how to access the Buzzy Bee. They are available online. So the last slide that Fiona and Alex showed had a couple of resources, and one of them was about Buzzies. There's also some information on the Starship clinical guidelines, and at the bottom there's a link on how to find Buzzy Bees, so they can just be ordered online.
We've got any more questions?
The next question is, can pharmacists vaccinate under 12? So that's a regulatory issue. Currently, no, because the COVID vaccine is only registered for 12 and over. However, when that changes, they will be able to vaccinate children. So it's a good idea to brush up on the tips and tricks so that you and your colleagues are all confident to vaccinate younger children. There is a question about consent. What do you do if one person consents, one parent consents, sorry, and the other one does not? Fiona and Alex, I don't know if you've got any recommendations on that. That's a very difficult one to manage, I can imagine.
That is a tricky one. It's going to be on a case-by-case basis, really, what you've got in front of you. It's if you have a parent with a child and the child is happy to have the vaccination and the parent consents, I don't know that it's likely you're going to have a consenting and an unconsenting person turn up at the same time. Yeah, like we said, it's always good to make a phone call if you're not sure who the legal guardian is, or if it's just a caregiver bringing a child. So it is really going to be a case-by-case scenario, that one.
Okay, and a similar question is, in the case of grandparents bringing in children, is it okay to get the parent on the phone to give consent?
I think so.
And that would be a yes.
Yes, in general practice, that's normally what happens. They would ring and get the parent on the phone for that consent. That's fine.
Great. Okay, so we've got one now about Emla. So if Emla has been applied, do they have to remove it during the vaccination administration, and do they just use water to wipe it? Because I know that it is a bit sticky. Is that what you would recommend, Fiona and Alex? Or
Yeah, just a tissue to wipe it off, and then you can just vaccinate straight away. You don't have to actually clean the site. You can just remove it. Yeah.
Fantastic. Okay. And now we have a more clinical question. So what is the incidence of myocarditis in children aged 5 to 11? We might pass that one over to Anthony Jordan, our immunologist.
Hi there. We actually don't have very good details on whether or not myocarditis has yet occurred in this age group. So we, at the moment, haven't given any indications that the 5 to 11-year-olds are any different from any other age group. Remembering that, although we've done a couple of million 5 to 11-year-old vaccinations so far, it wasn't until we got sort of into the tens of millions that we sort of saw a stabilization in the myocarditis range. So I would just use the same 10 in a million sort of range of myocarditis incidents until we get any more evidence. But interestingly, it's probably hopefully going to be less so far, but let's not overcall it too early.
Thank you, Anthony. There is another question about being able to vaccinate children, and that's come through for nurses that were retired, and they've come on board to help with the COVID vaccination response. So the question is, most of my staff are retired nurses and were given temporary authorisation. Are they also covered for ages 5 to 11? I wonder if you've got the answer to that one, Jean.
Yes, so the Nursing Council will have put a restriction on their practicing certificate, and some of the ones I've seen here are restricted that they can only work to vaccinate for the COVID, vaccination. So that would cover them. A lot of them have got practicing certificates that only go till February or March, so they would need to apply to Nursing Council for an extension of those practicing certificates.
Thank you, Jane. There's another one here that might be a good one for Fiona and Alex. It's, what if parents prefer the thigh rather than the deltoid for the vaccination area for a child?
Yeah, that's feasible to do. They can, if they were having 3 or 4 vaccines, they would use either both deltoids and the leg as well. Deltoid is preferable, that's best practice, but we can go to vastus lateralis if they need to.
And they would need to have had supervision, especially if they're provisional vaccinators, of administering in that area before they went ahead and did it.
Thank you. So a lot of that information is in the immunisation handbook, isn't it?
Yep.
Yeah, great. So that's a good reference to go to if anyone has any queries about that too. So the next question is, what would be the dose for administering to 5 to 11-year-old children? And that is as far as I'm aware, 0.1 microgram. So it's 0.1 mil rather than the 10 micrograms. So it's 0.1 of a mil rather than 0.3, but we're yet to receive the pediatric vaccine at sites. I understand that will be coming early next year. There is just one other question. Buzzy seems to be sold out. Any other suggestions for obtaining one, please? As far as I know, they are only available online, and perhaps there has been a bit of a rush of them lately.
When I looked the other day, the kits were sold out, but I think you can buy the individual components were still available. So like the Buzzy itself and then the ice packs, but it was the actual combined kits.
For some children, just a piece of ice or an ice pack with the whole numbing concept, that will work as well.
Okay, and another question, which is similar, is what about the cold spray we use for bicillins? So I understand that that is available over the counter, is that right?
Yeah, it is. And again, it's personal preference. If you've never had the cold spray before, some people can find it's a little bit jolting, but if it's a tool that you've used before and it works, then it's fine. And again, I think it's a bit like the Emla. We don't want to set a precedent that every child has to have this before an immunisation, but in specific circumstances, if it's what's going to work, then yeah, fine.
Great, thank you, Alex. I think we're at the end of the questions now and we're just out of time. The very last question was if the recording would be available, and I understand that's going to be emailed out to everyone that's registered today.
Yeah. So thank you everybody for attending the webinar, and thank you very much to Fiona and Alex for an excellent presentation and very helpful tips. And thank you to Angela and Anthony for helping with answering the questions. And just a reminder that when you click off the link, there will be a poll. Please answer the poll questions because we love to get feedback from you. So thank you very much, everybody. And this will be sent out to you, so you'll be able to share it with your other workers. So thanks very much. Bye.